Intravenous, or IV, infusion is a cornerstone of modern medicine. It's a direct route to deliver fluids, medications, and nutrients into the bloodstream. This is essential for patients who can't take them orally. IV therapy helps hydrate those suffering from severe dehydration. It's a lifeline for patients undergoing surgery, chemotherapy, or those in critical care. IV transfusions save lives by replenishing blood and its components. IV infusion is a complex procedure. It demands meticulous attention to detail and strict adherence to safety protocols. This guide provides a step-by-step approach to mastering IV infusion. We'll cover everything from preparation to troubleshooting. Whether you're a student, nurse, or seasoned medical professional, this guide will serve as a valuable resource. Remember, patient safety is paramount. Always follow your institution's guidelines and seek assistance when needed. Before starting an IV infusion, creating a clean and organized workspace is crucial. This ensures patient safety and minimizes the risk of infection. Begin by gathering all necessary supplies, including gloves, IV catheters, dressings, saline flushes, and the prescribed fluids or medications. Next, prepare the infusion pump if required. Ensure it's plugged in, turned on, and functioning correctly. Select the appropriate tubing for the medication or fluid being administered. Always double-check the expiration dates on all supplies and medications. Wash your hands thoroughly with soap and water for at least 20 seconds. Dry them with a clean towel. Put on a new pair of clean gloves. This step is crucial in preventing the spread of infection. Before initiating IV therapy, a thorough patient assessment is essential. Start by explaining the procedure to the patient. Use clear and simple language that they can understand. Address any concerns or questions they may have. This helps alleviate anxiety and ensures informed consent. Next, assess the patient's veins. Look for a suitable vein that is visible, palpable, and easily accessible. Factors to consider include the patient's age, medical history, and previous IV access attempts. Avoid areas with signs of infection, inflammation, or thrombosis. Review the patient's medical history, paying attention to allergies, medications, and relevant laboratory results. Ask about any history of bleeding disorders, blood clots, or previous reactions to IV therapy. This information helps tailor the procedure and minimize potential complications. Once you've completed the patient assessment, it's time to prepare the IV line. Start by selecting the appropriate IV catheter gauge based on the patient's age, vein size, and the type of infusion. A larger gauge catheter allows for faster flow rates, which may be necessary for blood transfusions or viscous medications. Next, prepare the IV tubing by connecting it to the prescribed fluid bag or medication vial. Close the roller clamp on the tubing to prevent air from entering the line. Squeeze the drip chamber and let it fill halfway with fluid. This helps prevent air bubbles from entering the patient's bloodstream. Prime the IV tubing by slowly releasing the roller clamp and allowing the fluid to flow through the tubing. This removes any air bubbles from the line. Once the tubing is primed, close the roller clamp and ensure the line is free of air bubbles. The IV line is now ready for connection to the patient's IV catheter. Section 5. IV cannulation, a delicate procedure. IV cannulation, the process of inserting the IV catheter into a vein, requires precision and a gentle touch. Before beginning, ensure you have all the necessary supplies within reach, including gloves, an IV catheter, dressing, antiseptic solution, and a tourniquet. Apply a tourniquet 3 to 4 inches above the intended insertion site. This helps engorge the vein, making it easier to visualize and palpate. Put on a clean pair of gloves. Cleanse the insertion site with an antiseptic solution using a circular motion, moving from the center outward. Allow the area to dry completely. Anchor the vein by applying gentle traction to the skin below the insertion site. Hold the IV catheter at a 15 to 30 degree angle. Bevel up and slowly insert it into the vein. You should feel a slight pop as the catheter enters the vein. Observe for a flashback of blood into the catheter hub to confirm successful cannulation. Section 6. Starting and monitoring the infusion. Once you've successfully cannulated the vein, it's time to start the IV infusion. Release the tourniquet and secure the IV catheter to the patient's skin using a sterile dressing. Connect the primed IV tubing to the catheter hub, ensuring a secure connection. Program the infusion pump according to the prescribed infusion rate and volume if applicable. Open the roller clamp on the IV tubing to start the infusion. Observe the drip chamber to ensure the fluid is flowing at the desired rate. Regularly monitor the IV site for signs of infiltration, phlebitis, or infection. Check the infusion pump frequently to ensure it's functioning correctly and the infusion is progressing as planned. Document your observations and any interventions taken. Section 7. Troubleshooting Common IV Challenges. Even with meticulous technique, IV therapy can present challenges. One common issue is difficulty in cannulation. If you're having trouble accessing a vein, try using a warm compress to dilate the veins. You can also ask the patient to dangle their arm to encourage blood flow. Another common issue is a slow infusion rate. This can be caused by a kinked IV line, a closed roller clamp, or infiltration. Check the IV line and tubing for any obstructions. If the line appears clear, check the infusion pump settings and the patient's positioning. If you suspect infiltration, stop the infusion immediately and remove the IV catheter. Apply a warm compress to the affected area to reduce swelling. Document the incident and notify the patient's physician. Remember, patient safety is paramount. Section 8. Mastering IV Infusion, a continuous journey. Mastering IV infusion is an ongoing process that requires dedication, practice, and a commitment to continuous learning. Familiarize yourself with your institution's policies and procedures regarding IV therapy. Attend workshops and training sessions to stay updated on the latest techniques and best practices. Never hesitate to seek assistance from experienced colleagues when encountering challenges or uncertainties. Remember, patient safety is paramount, and a collaborative approach ensures optimal outcomes. By embracing a culture of continuous improvement and prioritizing patient well-being, you can become proficient in IV infusion and provide safe and effective care.